Thanks for making a choice to join us this afternoon to participate in discussion on this very important topic. Let me start with my introduction. I am Siraj Irani, working with Mahila Housing Trust as Senior Program Management Specialist, and will be moderator for this webinar. On behalf of Mahila Housing Trust and Heriot-Watt University, I would like to extend warm welcome to all the eminent panelists and participants who have joined this important conversation today on unlocking best practices from community-led COVID-19 response in the Indian slums. As we all know, the world is facing worst public health crisis taken to respond to the immediate threat of COVID-19, including the shutdown of many economic activities for weeks, have led to global economic crisis and massive job losses, and major impact especially on the vulnerable groups. But in all this gloomy situation, we still have stories of hope, particularly from the urban slums. In today's discussion, we are going to learn how this marginalized community have managed to respond to this crisis using their network connection and relationships. But before we proceed further, I will just like to brief you on some house rules to ensure smooth delivery of this webinar. Firstly, may I request all the participants to please keep mics switched off during this session. The session is being recorded, and by participating in this webinar, you are giving your consent for the same. During presentation or discussion, if you have any questions, please put them on Q&A box. We will take your questions during question and answer session, which is planned towards the end of this webinar. And in case you have any technical issues during webinar, best thing to do will be to try to rejoin, as we have limited capacity to extend any technical support during webinar. I hope you understand. Now I would like to briefly introduce you to our eminent panelists. Today, we have with us Melissa Bedinger. Melissa is a research associate at Heriot-Watt University's Water Resilient City Project. Melissa has bachelor's in civil and environmental engineering and a PhD in business management and human factors from Heriot-Watt University. Her research interests includes human factors, complex systems, sustainable development, and water security. We also have with us Carrie McMont. Carrie is a PhD researcher at Heriot-Watt University. She has a MA in Geography from the University of Glasgow and a Master of Science in Climate Change from University of Heriot-Watt. Her research interest includes climate justice, environmental hazard, resilience, and social capital. Our third panelist is Bansri Sharma. Bansri is an urban planner currently working with Mahila Housing Trust. She has been associated with projects pertaining to climate resilience, participatory governance, and water sanitation for urban poor. And our fourth panelist is Shubhangi Dubey. Shubhangi works as a research assistant at Mahila Housing Trust. She has pursued her master's degree in economics with specialization in urban development. Her research interests includes sustainable development, waste management, and urban mobility. So for today's webinar, we have a perfect balance of researcher and a practitioner with expertise in urban development and interest in social capital. So I'm sure we are going to have very interesting discussion in next 1 hour. With this, I would like to invite our first speaker, Bansri Sharma. Bansri, before we get into the findings of our study regarding importance of social capital in community-led COVID-19 response, may I request you to briefly talk about Mahila Housing Seva Trust approach of creating this social capital. This background about MHT's approach will help our participants better relate to the findings and learnings from our research. Over to you, Bansri.
Thank you, Sirajji, for a warm welcome and introduction. I would briefly like to introduce you to MHT and the kind of work we are involved in. Established in 1994, Mahila Housing Trust's mission is to organize and empower women working in informal economy and provide them with capacity building so that better habitat, environment, and basic services are ensured at slum level. To achieve this mission, we follow a three-step basic process. Firstly, we try to establish credibility through establishing community-based organization and investing individuals and collectives through a particular initiative, that is building their capacities in form of imparting trainings to them. Secondly, we focus on directing public and also private funds to facilitate democratic decentralization so the women leaders from the slum communities can participate at local level decision making and also ensures effective service delivery at slum level. Thirdly, we try to expand footprints across different sectors related to habitat, which includes water, sanitation, energy, climate resilience. So since past 24 years, currently MHT is working in 9 Indian states and also having implementing partner in Nepal and Bangladesh. I would like to briefly take you through the MHT's approach of developing social capital. So central to MHT's work is mobilizing and organizing communities. It includes empowering them to address social, physical, and environmental issues they face so that they can take charge of their own improvement process. Now, I shall explain you the three-step process which we follow while we develop social capital. If you can see the diagram, when we enter any slum community, we firstly focus on household listing, that is serving each and every household of slum community and forming a community-based organization, which typically comprises of 150 to 250 households. And further, when this collectively the CBO members, they come and elect their community leaders, which are 15 to 25 slum level leaders, forming community action group. So CAG is a slum level representative collectively formed through majority consensus of CBO, while a CBO is a slum level community in which is headed by which is represented by a women headed household. So at slum level, there are two groups, CBO and CAG. When across different slums, the CAGs are formed, the CBOs coalesce into an umbrella called Vikasini. I would further explain what and who Vikasinis are. So over the years, when CAG members, that is women leaders at slum level, they become highly knowledgeable about their communities and also about their rights as citizens, and they exhibit exemplar abilities. So they start working at city level. First, their work and their expertise is usually concentrated at slum level, but over the course of 5 to 7 years, they start working in different slums across cities. So here they are called Vikasini. So in local feminine connotation, Vikasini means carriers of development. So Vikasinis at city level form a federation, and these Vikasinis are engaged in city level platform and city level decision making, and also helps strengthening their influence in urban development plans. While developing this social capital, MHT helps slum residents go through a training modules which last for a period of 12 to 18 months. And these training modules are typically focused on introducing slum leaders, women leaders, to urban structures, governance, how to liaise with government officials to avail basic services for urban development at slum level. So going forward, with this developed social capital in form of community action groups, that is CAGs, and Vikasinis at city level, I would like to share with you in past 5 months, especially during stricter lockdown and during introduction of COVID-19 in India, how did the women came forward and they responded to the crisis. So initially, with introduction of stricter lockdown and pandemic, there were critical issues which were emerging from ground. And these issues were concentrated around lack of financial security due to poor access to livelihoods, and also lack of food security. Thirdly, since the communities reside in slum, They were more susceptible to gathering in large numbers to access community infrastructure, which imposed a question on social distancing. Also, they were not very much aware and were able to avail healthcare facilities since introduction of this pandemic was very new with limited knowledge. And lastly, due to valid documents leading to poor access of government schemes. As we are aware that many special benefits were introduced by Government of India, but not every member was eligible and aware to access these schemes. So the approach which MHT and women leaders adopted was, since we had direct access, we could not access directly to slum communities, but through CAGs and Vikasnis, we were able to be in contact with slum residents. So these Vikasnis and CAGs were engaged in identifying needs, especially regarding food safety, and to understand barriers to local healthcare facilities. This included women leaders going house to house, ensuring all safety measures, communicating with slum residents at slum level, and quantifying the amount of needs for the 3 key issues which were identified. These issues and needs were later conveyed to MHT and supported by various donors and government resources and MHT's funds. They were helped by Vikasnis and CAGs to address these issues. So the key intervention on which the women leaders worked were creating awareness on safety and hygiene aspects related to COVID-19. So immediately the key thing which was identified was lack of awareness and knowledge regarding COVID-19. So these women leaders actively engaged themselves in sharing facts about the new virus. And secondly, supporting in distribution of ration and safety kits at community level. Since it was not very easy to physically access slum communities, hence the support of local women leaders was taken to ensure that all the help is reached to community. Thirdly, since they were actively working to avail basic services, community action groups and Vikasnis are usually formed over a course of say 3 to 5 years. So they had experience of engaging with local government, had local contacts, and they knew resources from where there was potentially a source of help. So before any help was, external help was reached, they themselves contacted various government officials and elected representatives, trying to draw financial as well as food resources for the slum. And lastly, they also facilitated slum residents to avail special government benefits. Now, there are usually various schemes and benefits for poor. So during COVID-19 pandemic, Government of India had introduced special schemes like Jan Dhan, Ujjwala, special government benefits for construction workers. But with poor knowledge and documentation, it was difficult for these residents to access them. So Vikasnis and CAGs helped them avail these benefits. So this was the key approach, or we can tell women-led response during the pandemic. With these efforts and supported by MHT, we were able to reach 428 slums during duration of past 5 months, spread across 9 Indian cities in 6 different states. This also included reaching out to 0.56 million people for COVID awareness. And this also included spreading awareness regarding government schemes to 0.3 million people, through which we were able to mobilize 13.26 million worth of government resources to poor, providing meals to 12.45 million people, and safety kits, approximately 35,000 safety kits were distributed across these slums. So here, I hope through my presentation, I was able to make the point and bring out clearly that when we have a social capital developed or local leadership developed at slum level, and we have active women leaders working towards development of slum, during any unexpected disaster or any unplanned event, it is their support and their proactiveness which helps reach the mass. So without their presence, it might have been difficult to reach to such a large number of people, providing relief to the tune of millions. With this note, thank you.
Thank you, Bansari. That was very informative presentation. And it was really heartening to see how the women of the community action groups have assisted their community in this challenging time of COVID-19. Now it's time for me to invite our second speaker, Subhangi Dubey. Subhangi will speak on the research methodology for this study. But prior to that, it will be great, Subhangi, if you could let us know why Mahila Housing Trust and Heriot-Watt University selected this very unique topic of social capital and its importance in the community-led COVID-19 response. I will also request you to throw some light on how did you carry out this qualitative field research, given that we had many restrictions and limitations due to COVID-19, particularly when the study was carried out in most of the cities in India, we had the lockdown scenario. Over to you, Subhangi.
Thank you, sir. Thank you so much for the introduction. Okay, so I am gonna talk about how the research was carried out and what was the methodology which was used during the research. So for the selection of the topic, as my fellow colleague Bansari, that she explained the social capital model of MHT with our own. So we, with our academic partner, Heriot-Watt University, we chose to dig deeper on the significance of building capital with the East methodology. This research highlights how the communities, they responded to the various issues and what were the challenges which they faced and how the network which they used to resolve the issues, they can be improved for better communication. Hence, our topic, unlocking best practice from the community-led COVID-19 responses in Indian slums. It was a qualitative research and it was performed over the period of 3 months. It was conducted by performing in-depth interviews. There were mainly 5 broad questions followed by some probing questions. So the first question was what were the main COVID-19 issues in the slums that the CBOs or the CAGs they were facing? This question was mainly asked to highlight the present situation of the people and also how they are handling the whole crisis, keeping in mind the 2 months lockdown which happened during the month of March and April and till May. The second question which was asked was, how did you become aware about the issue? So the main intent behind this question was to understand that how the information is getting communicated and how the people are receiving the information about the awareness, about its preventive measures, and if anybody is infected, then what all steps they should take and all of that. Thirdly, the most important question was that is this issue new and was it created after the crisis hit or it was already existing in their slum communities? This was mainly to highlight how the pandemic has impacted the life of the people and also to probe into the social distancing norm, which is one of the most essential norms in order to prevent this disease. So how that norm has an impact in a country like India. So for that, we had this question. Another question that we had asked them was, how did you already know how to respond to the issues related to food shortage or government awareness or linking the people to the various government schemes? So then it was mainly, interpreted that in a way to capture the social capital relations that were there before COVID-19 happened, and also to highlight the interdependence between various tasks which were performed by the community leaders. The most important question which was asked during the interview was, how did you respond to the issue in this case? It had a couple of probing questions like, what were the steps that you took? Whom did you contact? What was the role of that person whom you contacted? What information was needed to contact that person and to resolve the issue? and what were the challenges that you faced. This was mainly done to highlight the structure of system in terms of communication between different agents, be it social organization, be it a private player, be it any government agency, or anybody. So the last question had an important significance in highlighting and illustrating the whole process of how they came to know about the pandemic, how they dealt with it, and whether they were aware beforehand, and what all agents played an important role in the whole process. Okay, so then moving on to the selection of the issues and the sample size. For this methodology, we had to select few issues. So we came up with mainly 2 issues that we wanted to dig deeper into. The first issue was the food security, and the second was containing spread of COVID-19 into the slums. As we all know, because of the lockdown, and the livelihood was adversely affected, and there was no income of the people in the slums. So hence, food security was one of the most prime and the prime issue that came up while we were doing our background research on what issues we can work this research on. Also, the second issue was that as everybody, as none of the people have faced this pandemic or this crisis earlier, so it was quite new for everybody to kind of respond to it, to kind of understand that from where, what are its sources, what are its symptoms, how to prevent from, how to get prevention from it, and if you are infected, then how you can, get aid for it. So then this was another one of the, after food security, this was another most important issue that came across all the slums where MHT has intervened while it was performing its outreach activities. Okay, so then both these issues, they were carried out in 8 cities over 5 states that were Ahmedabad, Jaipur, Jodhpur, Delhi, Ranchi, Amalner, and Bhopal. Also, the interview was taken per issue per city. So total 8 interviews were taken for the first issue, and total 8 interviews were taken for the second issue. Also, the Vikasinis or the CAGs which were selected for these issues were selected with consultation with the respective city coordinators, and the method of selecting those Vikasinis and the CBOs were selective or sort of purposive sampling, which means that on the base, whichever community leader has dealt with the issue in detail and has responded to the issue in the best possible way was interviewed. As we all know that because of the lockdown situation, we couldn't go into the slums and have the face-to-face interview. So the medium of the interviews was through electronic media, that is either through Google Meet or through telephonic phone calls. We were under this impression that as we are not having these face-to-face physical interviews, so there might be a possibility of losing on critical information in terms of carrying out these interviews. But due to our strong network with the community, and all the interviews were very smoothly done, all the answers were quite well answered and in the most comprehensive manner. Also, one thing that I and Bansari, we have taken all the interviews, so which we also came across was while addressing and while talking about the first issue, that is food securities, the people were quite, they were quite receptive while answering the questions that how they dealt with the food security. And when we were probing them and when we were asking them that how they dealt with the issue of spreading awareness, so that receptiveness was not that much. One of the probable reasons that we came across by taking all the conducting all the interviews was that having the food security issue it is a very tangible issue. Like if anybody has a food shortage, you provide them with food packets or the ration kits, and that problem is solved, and you can see and you can assess it on the spot, and it has a very direct and instant effect. While for spreading awareness, it doesn't show the effects and the results or exactly on that time. So it was a little bit difficult to assess that, and it was also difficult for them also to talk about it. But then also with the probing questions and all, they were quite they answered it quite well, like that they worked on various things like distribution of masks and sending messages to the people, asking them to maintain social distancing, and with a lot of other things that were happening in the community. A lot of our community leaders were quite vigilant in maintaining all these norms. So they were quite active while while handling the second issue. Okay. So now, as we come to the methodology, is the event analysis of systematic teamwork method. So I'll give you a brief of how this methodology was used into our study. It is a multi-network analysis. So mainly it consists of 3 networks. First is the social network, second is information, and third is task. Social network is like who is connected to whom. Second is information, is like what all information is the social network, the people who are connected are sharing. And the third is the task, that how they are doing this whole process, or how they are understanding and dealing it with the issue. So all these 3 networks, they were built together and analyzed, and then they sort of emerged like properties like resilience. I can explain this with an example. For example, in Ahmedabad, one of the Vikasinis faced an issue of food shortage. So that is the issue, that is the information she got, that in her community there's a lack of food facility. So then she knew the counselor of her area. So then she talked to the counselor. So that is the part of the social network, that she's connected and she knows the counselor of the area. And then with the help of the counselor and the information which was available to her, that these many people are devoid of food, so she planned out her tasks accordingly. Like she made a list, coordinated with the counselor, got the ration kits and distributed. So that is the part of the task network. Okay, so then the process of using this methodology was done, that for every issue, the in-depth interviews were created. And as these interviews were in the local language, they were first transcribed into English. And based on these interview transcripts, the network models were built and analyzed. One of the most important rationale behind using this qualitative methodology for studying the social capital model and this for doing this research was that first of all, it creates multi-network patterns. Which is like that there are individual nodes which are created, but because every node is interlinked with each other, so there are new possibilities, new priorities, new nodes which are created, which we might not have, looked into or pondered upon if we are not using this methodology. Secondly, also it highlights the things that the communities, how the different communities in different settings react to the same issue, and how they create resilience, and how they create the community resilience, and how they become self-reliant with minimum intervention of any external agents. Thank you.
Thank you, Subhangi, for detailing the research methodology for this study. Indeed, the aspects you have tried to capture in your study will be helpful for wider audience, including many implementing agencies. It was also fascinating to learn how the qualitative research was executed in 8 cities of India, beside all restrictions and limitations we had during lockdown. After understanding the methodology of this study, I am sure participants are now eagerly waiting to learn about the findings emerging from this research study. So now it's time for me to invite Melissa and Carrie, who has been actively engaged in designing this research and bringing out some key findings from this study. Before I hand over to Melissa and Carrie, I will just like to request all the participants, if you have any questions for the first two speakers, you can post your questions in question and answer box, and we will try to answer that during the question and answer session, which is planned towards the end of this webinar. Over to you, Melissa and Carrie.
So hello, and thank you for the introduction. So as Bansari and Shivangi have been explaining, lockdown posed a number of new challenges, but at the early stages of the pandemic, previous MHT activities allowed community leaders to respond really quickly and effectively. So several interviews highlighted this, and one participant said, "No, madam, I was not knowing anything beforehand as the lockdown was announced and the pandemic rose suddenly. Then by seeing the problems of people, we understood things. And secondly, I had knowledge due to the organization with which I am associated, MHT. There I have seen people helping one another. So when we can fight for our water and waste, then we can fight for anything else even. I gained all these planning and understanding from there itself, and I am happy that I am able to do all these things." So it's a powerful quote, and as researchers, what we're really interested in is understanding how they did this in practice in more detail. Not just to understand if an approach was successful or if an issue got resolved, but to explore in more detail how and why this was successful using a structured method. So answering questions like, what was most important to securing a successful outcome in each case? And was it similar across different contexts? And as Shivangi explained, in order to do this, we started with interviews. And overall, 8 Indian cities were selected and 16 women leaders were interviewed, one woman for each issue for each city. Which doesn't sound like a huge sample size, but when you're going through all of these in-depth, semi-structured questions, there's a lot of really rich information from those. And that was all about how they responded to 2 issues or goals. First of all, containing the spread of COVID-19, and secondly, ensuring food security. So these are just some of the problems underlying each of those issues that participants spoke about in the transcripts. But our aim was to capture responses towards those issues. For instance, mobilizing food from various government and political contacts, or stitching and distributing masks to ensure safety or increase awareness of the pandemic. And Shivangi has done a great job of explaining step-by-step how this works, but I'll just overview a little bit again. Each interview transcript was coded to build a network of social, task, and information elements. And this was turned into a multi-network that showed who was working with who, what needs to be done, and what information was required. And also who was responsible for which tasks and which passing information between different actors. So these layers are connected to each other as well. The EAST methodology is ideally suited to analyzing bottom-up responses, where ways of working might vary across different contexts based on what resources are available. So by applying EAST to real-world operations, we can really explore if there are any patterns in how successful outcomes are achieved. And by using this structured approach, we can apply different metrics from network analysis to explore different types of social capital and how they play different roles. It's not that one type of social capital is the aim or is better than another, but they can each play a different part in a successful response. And we can use the network metrics to help understand this. We can also use the network metrics to see if there are any common patterns across all of the contexts, so that they're sort of comparable, even when you have different actors or different issues. You're looking at the structure of these networks. And being able to pull out those general patterns or trends might make for transferable learning. At least that's what we were hoping, and I think that's what we found. So that's a brief overview of the EAST approach. and I will hand over to Carrie, who will take you through some of the early results with some detailed examples of what these networks look like.
Thank you. Coding the transcripts identified frequently occurring nodes across all 8 cities for both containing the spread of COVID-19 and food security. So in the information network, important sources of information included awareness of people in need, previous training, lockdown, and sharing information with organisations. In the task network, providing lists of people in need, providing food ration, contacting organisations for help, and conducting surveys were frequently occurring tasks for both issues. Network metrics were applied to facilitate analysis of the 16 networks and identify patterns within the response. Betweenness Centrality identifies nodes which bridge connections across network clusters, so it identifies nodes which are key to the overall informational flow. Nodes identified with a high betweenness centrality mean they were influential to the overall response. As we can see, the nodes here highlighted in red would have a high betweenness centrality because they're able to bridge connections across networks that would otherwise be disconnected. The challenges that Melissa described and the information associated with them form the information network to show how one information source led to another. We can see that aware of food shortage and discussion of problems with private donors were key sources of information in the Jaipur food security network. The responses to these challenges were coded to form the task network. Again, those nodes in red had high betweenness centrality, so they were influential to the overall task network. Those tasks included providing food ration, distributing food locally, and the wider community asking for help. We can see that the wider community asking for help led to a range of different tasks, which eventually led to distributing food in external areas as well. Coding the transcript by who was working with who helped form the social network. We can see that the community action group member was connected to many different community members as well as different organisations. We can see that MHT and the government official were also connected to different organisations. These 3 networks were then combined based on who performed what task led to what information, and who received that information. So this is a key contribution of the ACE methodology compared to traditional social network analysis, which is just based on connections of the social agents themselves. But by combining all 3 networks, we can see that some new influential nodes have been highlighted. So trust was an important source of information in Jaipur for responding to food security. So previous training from MHT allowed the community action group member to feel empowered to contact organisations for help. This task allowed information on to discuss problems that the community were experiencing, such as why their area had been missed from food ration and why this might be the case, such as fear of overcrowding. So this information led to the task of informing the community to social distance, which in turn built up trust between the community members, the community action group member, and the organisations who were providing food. This in turn led to food being distributed in the area. When comparing the 2 issues by structure, they show a broadly similar pattern. We can see that containing the spread had required slightly more tasks than food security, and this just suggests that it was a more complex response with a lot more elements to it. However, the core structure was the same as a result of previous training. So the community action group members, or the Vikasinis, were able to respond to how the community was experiencing the pandemic and enable them to contact organisations for help. So this graph illustrates the network level betweenness centrality score for comparison by issue. So these plots are based on the 8 locations combined. So we can see that for food security, it has a higher betweenness centrality compared to containing the spread. But overall, the social networks were the most influential to both responses. So we'll now look at the results for the node level results. So these nodes were identified as having high betweenness centrality and containing the spread and for food security. So the takeaway message from these images is that, again, the social agents were the most influential to both responses. When comparing the spread of betweenness centrality by issue and location, we can see that social networks have a wider spread of betweenness centrality for containing the spread when compared to food security. So this just implies that there were more social agents who had a role in containing the spread of COVID-19, as it was a more complex response, whereas food security was more direct and linear in the tasks required. Taking the example of Jaipur, we can see that social networks still had the most influential response, but again, the spread was spread in betweenness centrality was amongst more social agents compared and containing the spread of COVID-19 compared to food security. And again, food security has a higher betweenness centrality for the task networks. So we can look at this in more detail when we look at the structure of the network. So for containing the spread of COVID-19, the most influential task was contacting organisations for help. So this resulted in a number of organisations providing help with this, such as informing the community to social distance, informing the community on best practices to prevent COVID-19, as well as providing emotional support, distributing masks and things like that. And that was spread amongst different organisations and the community action group member. When we look at food security, we can see that the most influential tasks were providing food ration, distributing food locally, and informing the community to social distance. And we can see that this was mainly done by the community action group member. How these networks are able to function can be better understood in greater detail by examining the role of social capital. Social capital can be defined as features of social organisations such as networks, norms, and social trust that facilitate coordination and cooperation for mutual benefit. Social capital can be divided into 3 different types of capital. Bonding capital describes connections that are close and have tight bonds. The network metrics used for that would be transivity and network density. When it has a high value, that would be associated with bonding capital. Bridging capital describes connections that span different social groups. The network metrics used for that would be betweenness centrality, effective size, or network density. When it has a low network density, it's associated with bridging capital. Linking capital describes connections between regular citizens and those in power. So that is the same network metrics as bridging capital. So in order to differentiate between the two, you would have to apply qualitative analysis to assess whether the connections were amongst social groups or connections to those in power or political connections. Bridging and linking capital can often be associated with transformative resilience, as they allow access to different resources and political connections which can bring about real change. So nodes with high betweenness centrality link otherwise disconnected networks, as we've previously seen. So that can be used to quantify bridging capital. So a node that has high betweenness centrality has high bridging or linking capital. This table just shows the social agents across all networks that were identifying high bridging capital. We can see that the auto driver in Ranchi was identified as having high bridging capital because they were connected to the Vikasini, but also to other communities when distributing food, and also to the organisation who was providing the food. So this was an important contact for the Vikasini to have because it allowed her to provide help in wider areas. Interestingly, the community also have high bridging capital. So this just shows the beneficiary role of social capital as a collective entity. So in other words, that means that the community as a whole benefits from the Vikasini or the Community Action Group's members' political and private contacts. Looking across the whole networks, these were the most frequently occurring nodes with high bridging capital. So that includes the Vikasini, the councillors, local women, the community themselves, the Community Action Group member, and MHT. Network density gives an indication of the role of social capital in a network, and it quantifies the proportion of potential connections in a network that are actual connections. This graph shows the distribution of network density for containing the spread across all 8 locations. So we can see that Amalner has a high network density, which means the source of social capital is bonding capital. In Ahmedabad, we can see that there is lower network density, which means the source of social capital is bridging capital. So that's not to say that one location necessarily has better social capital than the other, but just that there's different roles of social capital for within them. So for Amalner, there was high awareness of the pandemic amongst the community as a result of the councillor taking proactive action to inform the community about the lockdown, as well as the Community Action Group member taking proactive action to inform the community to social distance, but also the community members themselves would discuss the government guidelines. However, in Amalner, there was low awareness of the pandemic amongst the community, which resulted in the Vikasini having to mobilise her different connections in order to gain information and pass this along to the community. So this just is a visual representation of the social networks for Amalner and Ahmedabad. For Amalner, we can see that the Community Action Group member and the councillor still had high bridging capital, but the network was a lot more closed. And we can see for Ahmedabad, there was a lot more bridging capital to connect different members of the community together in order to respond effectively to containing the spread. Again, these show the different patterns for Amalner and Ahmedabad when combining all 3 networks together, and we can see that Ahmedabad is a much larger network. So both roles, bonding and bridging capital, were important for a successful response to containing the spread of COVID-19 in Amalner and Ahmedabad. However, the role of social capital was also important when responding to some unsuccessful responses. For Amalner, for food security, we can see that the Community Action Group member had an unsuccessful response when she contacted an organisation for help. However, when we look in more detail to the network, we can see that empowerment played an important role. Empowerment enabled her to query organisations who were providing food ration, as well as discuss problems with different organisations, which eventually led to the successful outcome of providing food for their local area. Empowerment was a key theme throughout the different transcripts, and it's effectively encapsulated by this Community Action Group member. She wants to convey that after associating with MHT, she feels that she has gained some different kinds of power. She feels empowered after joining MHT, and now she doesn't hesitate to talk with any senior person or sir. She can speak with confidence. She says that as a lady has someone to rely upon and support her. In the same way, MHT is like a support to her upon whom she can rely. So Bensari gave a really detailed overview of the success that they've had in responding to these 2 issues. This just presents a snapshot of the quick response and the successful outcomes as a result of the hard work from the Community Action Group members or the Vikasinis. For containing the spread of COVID-19, 3,000 to 4,000 masks were distributed. 5 women were taught how to make masks. Awareness was spread to 15 to 20,000 families. Information was shared with 60 people from different areas. A health check was arranged for 300 to 400 people. 15 to 20 people received help in accessing a doctor. 3,000 hospital coats were stitched. 80 people received received help in accessing government schemes. Public meeting spaces. For food security, just under 2,000 households received distributed food ration. 60 to 65 families received ration in external areas. 4,500 people received help in accessing government schemes for ration. 10 to 12 families received cooked foods. Money was collected for food ration to help an additional 30 to 40 families. And communities received help in receiving the correct measurement of food ration. So what does all this mean for best practices for community-led responses to different issues that may arise? Well, East identified a checklist of task and information steps that were required for both issues to respond effectively. So important sources of information included awareness of people in need, discussing problems, trust, as well as understanding people's fear around the transmission. Important tasks across both issues included contacting organisations for help, providing lists of people who were in need, providing food ration, and distributing food. So the key takeaway message is that social agents in the network were the most influential to the overall response for both containing the spread of COVID-19 and food security. And this was a result of previous training, which led to empowerment and knowledge of social and political connections, highlighting the important role of bridging and linking social capital. Thank you very much for listening, and I'll hand back over to Shiraz.
Thanks, Melissa and Carrie, for this wonderful presentation. One key learning that I take away from this presentation is that social networks are important to consider in any discussion of resilience because they describe with whom and how individuals interact, and also how that affects the distribution of the resources on ground. And I think that's very important for any implementing organization and government and funding agency to understand. Thanks once again. I can see now that we have a few questions in the chat box, and so we can open up our question and answer section. While I will start with questions that I have received in the chat box and over email, participants are requested to type their question and in Q&A box. I will try to take questions which are of common interest. And if you wish to address your question to a particular panelist, please do mention the name of the panelist. So I will like to take first question, which is addressed to our first speaker, Bansri. Bansri, the question is, as a practitioner, how easy or difficult it is for urban poor to develop, acquire, and utilize social capital?
Thank you for your question. Starting with the first action, developing social capital in urban slum communities. Taking my work experience working with and for slum communities, it is not very easy if you have to establish a social capital or say a local level leadership in slum. Especially, we are trying to target the population who are naturally worried about their next meal. So unless and until if you don't have any strong driven motivation or any tangible benefit which you can show them, it is difficult to develop social capital. But yeah, that is why intermediary organizations like MST are here for. Secondly, while acquiring and utilizing social capital, if we try to develop only at slum level, it might not work very robustly. As Carrie mentioned in our presentation, and what our research has also brought out, that always establishing a bridging capital, that is networks across different slum communities, or for instance, developing networks across different community action groups, and each community action groups represents a slum. So if you have a good bridging capital at city level, and that is how Vikasini Federation forms. So this robust networks makes it more efficient if we are trying to utilize or acquire the developed social capital to bring benefits. And thirdly, most important thing, while addressing this natural leadership or developing these leaders, it is equally important to keep into loop the municipal leaders. So here comes the role of, I would say, linking capital, which Kerry was mentioning, that the relationship between slum residents and the representatives who are in position of power. So when you try and address these three nodes, that is slum communities, intermediary organization, and people in leadership, this whole network helps to deliver efficient and effective results, also improving their habitat. So yes, I hope this answers the question that yes, it is difficult to develop naturally, but while acquiring and utilizing this social capital, we need to address all the links and all the main actors and nodes in the system.
Thank you, Bansri. I think that was a very comprehensive answer. Now we have a question from Sarah, and it's a long question, but I will try to put it in a couple of lines. The question, any member from the panelist can choose to answer this question because it has not been addressed to any particular panelist. The question is, do you think inherent characteristics like trust, community leaders, local government partnership, etc. of the grassroots organization like MHT help in building community resilience? So in light of the studies, if we want to answer this question, so I will request if Melissa or Kerry wants to take it up, that while you were analyzing this data, have you noticed that this inherent characteristics like trust, community leaders, and the local government partnership plays an important role when we are talking about resilience in poor urban communities?
Yeah, I'm happy to take this first, Kerry, and you can follow up if I've missed anything. But I think that's key. So while Bansari was just making the point that if you start out going into a new community and expecting to just build social capital without any real connection to a tangible outcome that people will connect with, that's really difficult. We've kind of seen this from the research perspective in reverse, where we've seen these communities that have already have a community action group established and Vikasini established. So the social capital has been built up a little bit. And from the network analysis, what we found were the key things really were the trust and empowerment, and those community action groups or Vikasini were almost stabilizing or consistent influences on the rest of the network. So when we talk about resilience a lot as academics, especially, we talk about it in a really abstract way because it's complex. But what I think the main takeaway from the research is that when we talk about community resilience, I come from an engineering background, and often we focus on the hard resilience, like Kerry and I were discussing yesterday. It's very engineering focused on infrastructure and things like this. But really the root of all of these positive, tangible outcomes is the soft resilience. So these things like trust and empowerment are key. You wouldn't have transformative resilience without them, I would say.
Thank you, Melissa.
Yeah.
Kerry, do you want to add? Yeah.
Yeah, I think Melissa answered that very well. I would just like to add that something that came apparent throughout the transcripts was the trust, not only between the Vikasini or the community action group member and the organisations, but also between the Vikasinis and the community themselves. So they could see that food was being distributed to those who were most in need, and also with different organisations, because the lockdown obviously imposed restricted movements, but having that association with MHT, there was trust that things would be done cautiously as well. So all these things take time to build up the social capital work that's been done, which helped with remain resilient to this new issue caused by the pandemic.
Thank you, Carrie. Next question is from Faith Taylor, and again, probably Carrie, you will like to take up this question. I'm just reading out the question so I don't miss out any important comment that he has made. I was wondering if you could comment on the scalability of the method, the research method. It sounds quite time consuming to undertake and code the interviews. How representative of the wider social network do you think your sample is? Do you need to interview more, or is this group sufficient? I think there are 3-4 questions, and Carrie, I will leave up to you how you want to answer it, but I think those are interesting questions,
Yeah. So it was quite time consuming to code the 8 transcripts for each issue. So there was 16 in total, and you had to build 3 networks. So for social, information and task, and then an additional 3 networks to combine them together. So that was quite time consuming. A limitation is that we only spoke to the community action group member of the Vikasini, and the response was focused on successful outcomes. So another interesting angle that could be taken further would be to interview other people in the community to get their perspective on the response and who their social connections were and things like that as well. Melissa, I don't know if you want to add to that as well.
I think that's, I can tell what Faith is trying to get at, and it did take time to build this up, but I think it's a good blend of taking these really rich qualitative responses and putting it into something structured and comparable across a lot of different contexts. Like, it depends heavily on the interviewers knowing what they're doing, which Bansari and Shpanki did an amazing job of following up with different questions and bringing out these really rich insights. And then Carrie had to quickly, for this short rapid response project, come up with a method of coding these interview transcripts, because traditionally EAST is done for socio-technical organizations. Like, it's used to study naval operations or things in very closed systems. So you're not usually interviewing people in this way. You're usually looking at them in a simulator or watching a scenario play out in very granular detail, compared to what we've done here for the sake of time and to see if this novel method would provide any useful insights. We've taken quite a broad view. So I think given more time, we probably would have interviewed more community members to get a better idea of the further reach, and also probably fine-tune some of the questions to allow for different perspectives from community members. We were really pushed for time on this one, but I think the scalability of it would be a challenge if you were doing this in a longer research project. I think a lot of the structure of it would remain the same. But I hope that answers the question.
Thank you, Carrie and Melissa. I think next question is addressed to Bansari. Bansari, in your presentation, you nicely explained the MHT approach in creating the community action group. The question is like, is external intervention always required to create this community organization, or have you seen such organization originated through local initiatives?
No, I think when we have to, like I already mentioned in my previous answer, that when we are targeting a particular group of population, here we try and work with urban women residing in slum settlements. So always an external intervention or a motivation-driven factor is required when you try to establish a community action groups or local level leadership. Also, the vital factor here to be considered is that when we try and form social capital, it is important to make them see the slums or results which we have already achieved. So here we try and carry out few of the exposure visits and try to showcase our past work. So this tries to instill a stronger confidence and faith in organization and in the work which we would be trying to do with that community. So yes, we would require external support, and it might not be possible for a group of women residents who are struggling with their daily issues to come up and work for other development purposes at slum level.
Thank you, Bansri,
Yes.
for your response. Okay, so next question is regarding government scheme. So the question is, what kind of government schemes were unlocked and how? So I think this is with reference to Bansri, the part you covered in your presentation, or Subhangmi, whosoever wants to answer, that the CAGs were actually helping this community member to access the subsidies and the schemes that government was providing. So you can take it up, yeah. What kind of
Yes.
government schemes were unlocked and how, yeah.
So the interviews were carried out in 8 different cities, as Shubhangi mentioned, and each city or each state level, they had different types of government schemes, but the common one which were introduced recently by Government of India includes Jan Dhan benefits, also Ujjwala Yojana, in which cooking gas LPG, in lieu of that subsidy is given in the account. Secondly, special monetary benefits to construction worker. Also, if I talk about in Rajasthan, we had Bhamasha, which was also monetary compensation to BPL families. So these were the schemes which were introduced specially during period from March to June. And CHEs and Vikasinis, though there were written information on newspaper, TV and radios, but there is always a gap when we are trying to reach slum population. So the slum leaders or women leaders helped reach and give information about these schemes to slum residents. Yeah.
So Bansri, just to follow up on this response, so where was the gap? People were not having access to the information, or people were aware about the scheme, but they were unable to avail it. So it's in terms of any formalities that they need to complete for availing those benefits. So when you were interacting with these urban slum dwellers, where did you find the gap, and how CAG helped them to address that gap? I think that's the how part that a person wants to know, I think, yeah.
Yes. Okay. So if I decipher the scenario over a course of 3 months, during initial first month, yes, there was a gap in awareness regarding the schemes, but gradually slum residents were aware about type and nature of schemes and what type of compensation they will receive. But then here comes the role of valid documents which they had to possess and how to access those schemes. For instance, they did have Jan Dhan accounts, but they were not very sure documents to use. There were instances like the Aadhaar card was not linked to bank account, or some issues with banks, and which day to access, since we were into a stricter lockdown period, things were not very normal. So here was a gap in accessing those schemes, which majority from interviews which we took, we understood that more than awareness, of course, it was how to avail those benefits. So I think hope it answers the question that more gap which we visualized or we could feel was how to access this monetary compensation or benefits and how to update the valid documents. So that is where Vikasinis and CAGs played their role.
Thank you, Bansri. That was really helpful. Melissa, next question is addressed to you. And what constitutes social capital, particularly in urban context, and how it will differ in the rural setting? So I do understand that this study was in urban slum area, but question is also about whether if we are carrying out a study in the rural area, will you have the similar kind of findings, or it will differ? So up to you how you want to take it up, yeah.
I think Carrie will probably be able to add to my response, but there are clear differences, obviously, between urban and rural. And at least in the UK, the rural areas tend to have higher social capital. And in this study, I think one of the things that came out of the transcripts was that the presence of migrant workers that were maybe not transient as such, but coming in and out of the slums at different times, meant that there was a regularly changing community. So the local community action group or other women leaders became, like I sort of touched on in a last response, it was sort of a consistent or stabilizing influence for the rest of the community, particularly for implementing things like safety strategies. So ensuring a boundary around the slum and only letting in residents, or making sure that certain people were quarantined and having access to food deliveries and things like this. But in terms of transferring the methodology to a rural area, I think it would be similar. I think you might find similar things, that the community action groups and the local leaders and these softer resilience measures are the key aspects still. That's partially because of the broad scope that we took when we conducted the interviews, in that we're trying to quickly capture the perspective of the local leaders. It might differ slightly if we'd had a longer study, and therefore the number of people interviewed would be greater for an urban area than for a rural area. And so some of the smaller nuances in the networks might be different. But I think the overall key nodes would be similar. That's slight conjecture, but that's what I would expect.
Yeah, I would agree. The only thing that might be quite interesting to explore with the differences in urban and rural settings is the type of social capital. So, for example, bridging capital might be more apparent in urban or slum settings and compared to rural, where it might be more bonding social capital because there is a more stable community. So that might be an interesting highlight that the methodology would show if you were comparing it with urban and rural settings.
Okay, thanks Melissa and Carrie. The next question is addressed to Shubhangi. Shubhangi, how at MHT do you plan to use findings from this research? And how do you think other organizations working at community level can also use it? So it's more about wider application of the findings from this research.
Okay, thank you for the question. I think as earlier Melissa and Kerry, they mentioned about the bridging capital and the linking capital, about the whole network, how it is spread across various agents. So I think if we can incorporate some changes in our training modules, which we have for the capacity building of the community leaders. As Bansari mentioned in her presentation that we formed the CBO and then the CAGs and the city level leaders, the Kasmi. So there's a set of module which we follow and the set of trainings which we conduct. So if we can have the trainings more inclusive with in regard with the methodology that is used here, and how their response and how they use their social network of connecting with the different agencies and how they perform the task, and if it can be more inclusive, so I think that that is how in one way we can use it. And I know it is a long process of building capacities. Of course, with building capacities and with building soft skills, you have to give them something in terms of building infrastructure like toilets or any other construction. So it will get in that process that with the tangible things you can build these intangible soft skills. But yeah, I think we can start with the trainings and we can have it more inclusive, and we can build capacities through that. I would like if Melissa and Kerry want to pitch in something else.
I think for me, the key thing from this, in terms of what's transferable for other organizations, is it might just be my perspective because I work in human factors, and a lot of that is going into organizations or systems and trying to show what makes work productive or effective, instead of ordering people to do a certain thing in a certain way and expecting a successful result. And what we find is that people, once they have a core skill set, will adapt for different situations, and we need to allow for that adaptability. So this was an exercise to an even greater extent than a closed system like an organization. This is an exercise in being able to say, yes, we can pull out a list of core tasks about how to achieve food security, or core tasks about how to create a checklist for how to contain the spread for COVID-19, but it's always going to vary based on context. So that's important in the short term, but what's more important in the long term is the finding that regardless of which issue and regardless of the specific tasks in which order they go in, the softer investment in the building social capital and the softer resilience measure is going to be deeper and longer lasting in terms of impact than investing in things like training people to build a tangible thing or training people to follow a specific procedure. So for me, that's it's kind of academic, but that's the main takeaway for me.
Thank you, Subhangini and Melissa. We have a next question from Manasa Acharya, and that's a very operational question, but it's an interesting question. The question is, how did the community leaders, Vikasni, communicate the nuances of the government schemes to the community? Where these groups, where they were organizing the group meetings, how they were interacting with the community member? I think sharing the information about government schemes with the members of the slum or the household, how they were communicating with each other, considering the lockdown situation, and also maintaining the social distancing norms, which were very much essential. Bansri, Subhangini, whosoever wants to take it here.
Okay. From the interviews which I took, so most of them, they were quite vigilant, I would say, in understanding the norms, the social distancing norms, and they were quite aware about that in their community, because the houses are small, there is not a lot of space, so the social distancing norm is quite difficult to practice. But then also they were not meeting people in a common place, or they were like, trying to, people will gather, and when they're spreading the awareness or when they're distributing masks, so then those two people will, decide and divide the community into parts, and one person will go from house to house and they'll talk from a distance. They'll tell them about various information like regarding government scheme or the COVID-19 awareness or a food shortage situation. So whatever information they wanted to get, they tried that one person can go and give that information, or whatever phone numbers they had, they tried to convey it through the phone. Or there was one Vikasini who also runs a shop at her place. So of course, during the pandemic, a lot of people were not visiting. So then all the helpline numbers which were there, so she just wrote it on a chart and just hang it out in front of a shop. So at least if the people who are passing by, they can look at it and they can be informed, okay, fine, if there is a case, so these are the numbers I can call. So then this is how they tried to, spread the awareness and be be in touch with the community without, gathering them or having a so-called formal meeting. So that is what I came across. Yeah.
Thank you, Subhangini. Next question is addressed to Melissa, and that's a very academic question, but interesting. How do you see social capital fitting into the overall urban resilience framework? Shall I repeat, Melissa? Yeah.
Yeah, I've touched on this a little bit, and I don't want to get too repetitive, but what I've found with this method is that the tangible measures for like physical infrastructure or a tangible outcome, hard resilience things, they're important, and so is the soft resilience and the intangible measures. But what we've done with this method is operationalize how social capital informs or creates this softer resilience, and then that follows on to the more tangible outcomes. So I think it's showing a clear progression to tie the academic concepts together in a way. And it's things that organizations like MHT already know intuitively because you've been working on this way for many years. But it helps the researchers really understand what resilience actually means in the real world instead of just an abstract concept. And the emphasis on different types of social capital is going to differ based on the context, but being able to apply these network metrics just helps us understand the different roles that they might play in those different real world contexts. And I'm really happy about the amount of scenarios we've been able to analyze in this short period of time, because it's allowed us to compare and contrast these a little bit. Instead of just doing one qualitative case study, we've really brought out and shown a pattern that I think intuitively some of us know is there, but the method really bore out in the results as well. So I think it's showing how these things translate into community resilience in a really deep way that's transformative, not just training people to address a specific issue and then being able to follow a certain protocol and return things to the status quo, but by tying social capital and softer measures of resilience to community resilience as a whole, we can see how we should be doing it in order to create a new normal and be able to respond to these unprecedented issues. And that just feeds forward into more resilience in the future. You can already see from some of these transcripts that by navigating these unprecedented issues, there's now more trust built up in these areas that's probably going to feed into more community involvement and more links in the future. So it's a roundabout way of saying that resilience is really complex, but I would start at the root of these softer measures, and this social capital is the underlying reason for that.
Thanks, Melissa. And we are left with time to take one more question, and that's, I think, the most important and interesting question. Bansri, I will like you to take up that question. I think this study has clearly highlighted the importance of social capital in responding to the crisis such as COVID-19. But in your experience as a practitioner, how easy or difficult it is to mobilize the financial resources to develop such social capital?
So the very vital point, I think, I'll try to answer it. We are propagating a lot of social capital, but yes, of course, we always require financial resources which can support the initiatives. Mostly from my experience, the organizations are more driven towards tangible results. So whenever a project is getting implemented, more focus is towards delivering service delivery, which could be quantifiable. But to my experience, if I quickly bring out the point that during MHT's formal training, it was never a part of the sessions that if there would have been a pandemic, how CAGs or Vikasini should work, or if there would have been a lockdown, what actions they should have taken. But from their past experience and consistently working for the slum communities, bringing in basic services and engaging in formal trainings with MHT, they were equipped with knowledge and experience to take up during this difficult situation and help their communities. So considering a component of a project, I think significant proportion of funding or financial resources should get mobilized towards developing social capital, because MHT will be there in slums for 1 to a maximum 5 years of the project implementation period. But I think we aim towards robust implementation and long-term planning. So here comes the role of making these communities self-sufficient. So when organizations like MHT take up back foot, they are equipped themselves to take up emergencies like COVID-19.
Thank you, Bansri. I think that was really important and a very good remark to conclude. I can see in the participant list that we have some representative from the donor agencies also, so it's a good takeaway for them. I think we now have to conclude because it's already the time that we have allocated. So as a concluding remark, I will like to state that disasters are and will continue to be a challenge in both developed and developing countries. And with this understanding in mind, it is important that communities build social capital in advance of disaster. I think it is also extremely important that implementing partners and the funding agencies extend their support to the vulnerable communities in doing so. It is important for us to recognize the importance of social capital as an asset. Any implementing agency is going to work with a selected community for a specific duration. It may be 2, 3, or 5 years. But what community is going to take forward after the project is concluded is the asset they have created in the form of social capital, which will help them to address their future development issues and crises. However, policymakers must recognize the limitation of local social capital, which may not always be effective in mobilizing resources that are outside of the communities and may therefore require assistance to access and utilize these necessary resources to build resilience. I think from this study, it was clear that the role of an external assistance was played by Mahila Housing Trust in these slums. And similarly, the role is played by other non-profit organizations in other parts of countries. I think that's why it's important to understand that the role that the local implementing partner is playing while we are talking about building resilience. With this, I would like to conclude this webinar, and I hope you all enjoyed today's discussion. I will once again take this opportunity to thank all our panelists for taking out time and interact with us. I would also like to thank all the participants for joining us today on this webinar. Thank you, good evening, and have a nice day.